PowerChart has many different dashboards which highlight important information throughout the patient's journey, depending on which dashboard you are on. For example, the discharge dashboard. The discharge dashboard has customized columns to focus mainly on the discharge process for a patient. Dashboards can be identified by this icon. Dashboards are based on a standard patient list functionality, so you will need to have a patient list set up before you can use it. You can refer to the patient list module if required. When you first open up your dashboard, you will need to select the patient list. Here I'm going to select iFilled. As you can see from my discharge dashboard, I can see some of my patient information, whereas some of the other information has been greyed out. This is because I have not established a relationship with the patients that are greyed out. To do that, I need to go over to the sides and select Establish Relationship. I can select one or more, or I can highlight Select All to tick all of my patients. You may be presented with a drop-down relationship box. So for training, I'm just going to select Database Coordinator, and then I will select Submit. This will now load up the clinical information for my patient. Now that I have established the relationship, I can see some of the clinical information for the patient. It is best to do some customization on your smart card. And to do that, over at the side you select your page menu and then select Layout Configuration. So here we can see all the columns that are presented on this dashboard. Here, under Pinned Columns, is my patient's details. Pinned columns will not move when you are scrolling through your dashboard. You can also see that it is has a padlock, which means that is locked and we have to remove that column. Ticking and unticking will display or remove from your dashboard. You can also customize this by clicking and dragging, so you can put your columns in the order that you would prefer. So for example, if I wanted to show allergies, I would tick it for my patients. And if I wanted to move that into a pinned column, I can select it and drag it up. Also change the rows. Here when I select rows, as you can see, I can only see 2 rows of information. If I select 5, it will pull through some further information for me. Once I've done all the customizing on my columns and my rows, I need to select Apply. Now you can see that I have added in that additional information. So my allergies is now in one of my pinned sections, as I had asked. When making any customization changes, you must select Task and Exit for it to remember your customizations. Depending on your dashboard depends on your columns, and the best way to work through the columns is to hover over the tops, and then you would be able to see what each column is. So for example, this chart has a ... but when I hover over it, it will tell me some further information about my column. Each column will provide you with additional information when you select into it. For example, when I select into the patient's details box, it will pull up an additional window with some further information. This is Access iPass, but I can also select these additional tabs for clinical data, and we can see the care team provided for the patient as well. To close these windows, I can press the X up at the top. Some of the columns can also provide you with quick links. For example, when I select in the PCR Person Completing Record column, I'm then presented with an open form hyperlink. When I select that, the form will load up for me, allowing me to input the information needed. Once complete, I would sign my form, and then it will update my dashboard as long as I refresh the dashboard. If I wanted to open the patient's record, I can select the blue hyperlink on the patient's name, and then it will open up my patient's record. To close it and to go back to my dashboard, I can just click the blue cross up at the top here, and then it will take me back to my discharge dashboard. Remember that PowerChart never refreshes itself, so you must always select the refresh button to ensure that you have the most up-to-date clinical information for your patient. Also, if a patient is transferred onto your list, you must select Establish Relationship to be able to view their clinical information. For this training video, we have just gone through the discharge dashboard, but do not forget that if you select this drop-down arrow here, you are presented with more dashboards. And depending on your department, depends on which dashboard you will be using.